discuss or write that down in a notebook. After that, after the lecture, we'll discuss all doubts. Okay. Now, first of all, what is infertility? Basically, infertility is always there in men and women both. Okay. Some people have very less, some have more of infertility symptoms in the body and mind. Now, the ones who have less, for example, there is this polycystic ovaries syndrome or polycystic ovaries disease or disorder, PCOS or PCOD as they call it, that is in 80% females. Nowadays, that is so surprising. In last more than 10 years of my practice, I have never seen such a situation. Every second or third female contacting is having PCOS or PCOD symptoms. Some of them have children, some of them have 4 or 5 children, but PCOS is there. Some of them cannot even have one child. PCOS is there. So, one disease is there, one symptom is there, it does not mean that the childbirth will be blocked by that, okay, or affected by that. Now, nowadays in last 3 years, almost I have seen this change. Almost like 80% charts comes to me, I see and I just immediately tell them that, oh, you have PCOS. And they confirm this, yes, I contacted the doctor and gynecologist confirmed that you have PCOS symptoms. That is the downfall of life, because Jupiter is Jiva. Jiva means Jivan, life, okay, new beginnings of life or childbirth, progeny. And it is a downfall because almost every, we can say 8 women out of 10 are having obstacles in that. What future we see? First of all, we have to understand what are the basic causes of infertility. There are, the first level is physical symptoms or physical problems. There can be weight issue. So most of the PCOS patients we see, most of them, not all of them, most of them we see weight gain. Okay, a lot of weight gain is there. They have abnormal hair growth. Some of them even have mustache or beard, like, you know, on the face there is a lot of hair growth. There are other factors, physical factors also, like as I said, polycystic ovary syndrome or PCOS can be a big cause. Okay, there is a pelvic inflammatory disease that can also be there. They call it a PID. You can write PID in short. So PID can be there. There can be age factor. Okay. Now, nowadays what is happening, girls, they marry at the age of like when they are 30 plus. Now, in that situation, we have to understand, Shushruta says that for a girl gets prepared physically, okay, I'm saying physically, girls get prepared for childbirth at the age of 18, 19, okay, and she get completely mature at the age of 25. So 24, 25 is a good age for getting married, or before 35 it should be done, because after 30 your chances to get pregnant normally start getting reduced. Okay. Whereas for a male, now female, why he specifically focused a female to get married and have a child before the age of 30? Because childbirth depends on the mother only. Father has to just give the sperm. There is no other such role if we talk about father. Even though we will see later on how the karmas of father also creates a big trouble there. But most importantly, it depends on the mother. Now you see that for men, he says that if they get prepared at the age of 25, not at the age of 18. Okay, they get ready at the age of 25 and they get matured after the age of 30. So he says a man should marry after 30, a girl should marry after 25 basically. Okay, so those are the age factors we have to keep in mind. Now, second factor comes here, that is in 60% you can see the physical symptoms are there. Okay. Now, in 90%, or I should say 100% females who are having or facing infertility issue, you will see psychological issues there. It is like always. Now, psychological, from where it comes? It comes genetically. Mother was having a depressive personality, girls adopted that. Okay. Or great grandmother had that and the girls adopted it now. Okay, maybe you have infertility, you have depression, you have anxiety, you have frustration or other symptoms, and that is coming from your great grandparents. For that we check 7 generations. In 7 generations it flows. In the 8th generation the genetic patterns will be changed. Okay, so it can be genetic, it can be lifestyle related, like your diet. You drink alcohol, you drink cold drinks or such things. You smoke, you take drugs or marijuana or charas or something like that. You eat non-veg. That is strongly affect the diet. Or your routine. You are awake all the night and Vata is increasing in the body. You are not taking enough sleep. Maybe it is a work pressure, it is a home pressure. There can be different family pressure and other things. But you are not sleeping, you are not taking enough sleep. That will increase Vata. You sleep too much in the day. Like in the night you are sleeping, in the day also you are sleeping. That will increase Kapha too much in the body. Okay, so Vata Pitta Kapha disbalance can be there due to your lifestyle. So that is a big thing. The karma, your past life karmas, environmental energy. Now that is something we have to see. We will discuss in the birth chart. When you take birth, at the time when you come out of the womb completely, how the universal channel energies were making pattern, making connection with each other, that strongly influence your personality, your mind. Your mind is also energy form. So it strongly affects your mind. Okay. So that is strongly important. That is very important to see that how they are influencing you. We will see that in the birth chart. Okay. The next can be evolution disorders. Okay, they can be there. Uterus abnormalities, they strongly create the infertility issue. If your fallopian tube is damaged anyhow, that will be a big factor for infertility. Okay, so these are many factors which in the medical terms, in the eyes of medical science, they are the causes of infertility. Now, how you see that in birth chart? Okay, there can be any of these symptoms, but how you see that in the birth chart? First of all, as I said, karma, your past life karma and the cosmic energies, how they were at the time of your birth, they strongly affect you. And at the time when you mate with your spouse for conceiving, at that time the muhurta, at that time how the universal, the cosmic energies are affecting yourself and your partner's energy, that strongly matters. Okay, so here we see two charts. One is your birth chart, the birth chart of mother and father. Now we give 80% weightage to the chart of mother, 20% to the father, because father have a very small role here, mother has a big role. So her birth chart as well as the chart, Prashna chart of the moment when they actually mate for conceiving. Okay, two charts we give more importance. Now past life karmas, they come there in the form of Jupiter. You see, Jupiter is the one who shows your past life punya karmas, your good karmas from previous life. 7th house in the chart, basically you will see, you will focus on the 5th house, right? What is the house of children? 5th house. So you will give importance to the 5th house. But 5th house is secondary to see. I never first look at the 5th house for children. I always look at the 7th house. The reason, 7th house is of your partner. If there is no partner, if there is no union between two people, how there can be childbirth? First thing, your partner is quite important. Okay. Secondly, 7th and 8th house shows the reproductive system. Sexual organs are there. So that is quite important, right? Secondly, in the 7th house is marriage. Now you see 5th house. 5th house is 11th from 7th. 5th house is 11th from 7th. Means the gain or the result of 7th house. 7th house is union with your partner. So you go in bed with your partner. Now you mate with your partner and the result comes in the 11th house, in the 5th house, in the form of children, in any other form. If you are in, you have a business partner, you shake hands, you do the business deal, you sign, what you will get from that business deal? That will be the 5th house, okay? Now, we also see in the divisional charts, we see D7. Now, D7 is again the fruit of the 7th house. It is not the chart you see for children. It is the chart, now, word matters, okay? So, we do not see D7 for children. We see D7 to see the fruits of union with your partner. Either your spouse, your romantic partner, either with your business partner, either with some other partner. All the results, the fruits will be seen in the D7 chart, in the 16th division, and you see the 5th house, okay? Those are quite important. Now, how you should see? From the moon lagna, it will show the mental union of two, and the results, how will you, when you mate with your partner. Now many people say that I don't enjoy connecting with my spouse, because from moon lagna it is not giving you benefic results. This is enjoyment is in the mind. Physically are there results, is there conceiving and other results? You should see always from rising lagna, from the ascendant, okay, from the 1st house. You should always see that. Now, how the society sees anything, that we will see the Arud lagna. Now, when a female cannot conceive, and see, when I do a reading for a couple who are having infertility issues, female always says one common statement, that sir, I am really horrified, I am really depressed and frustrated because of the society, my in-laws, my relatives, even sometimes my parents or spouse, for what they are saying and how they are torturing me, their comments. Now that is something, how those people are looking at you, you see from Arud Lagna, that will they support? In some families they support. They simply say that, okay, if you cannot have a child, just adopt, or even don't worry about it. There are some in-laws like that. There are some relatives like that who supports. Whereas some, or I should say most of them, are the one who want to torture you. So you see Arud Lagna for that, okay. Now, let's coming to point that how you see if there will be infertility issue or not. Now, first of all, you have to see the 7th house and 7th lord and the planets placed in the 7th house. What is the union showing? How is it working? You should see the 7th house and Jupiter, 7th house lord and Jupiter in the D7 also. Its condition, okay, what is the condition there? Is it making any relation with Jupiter? That is important. Now you should see the 5th house and 11th house and the 9th house. 11th house is overall gains. The 9th house is 5th from 5th. Okay, so it is the protection of 5th, or is it is the result, the creativity or the result of 5th house. Okay, so you see the 5th house and 9th house, and you see if the 5th house, 5th lord and 7th house, 7th lord, 9th house and 11th house are making any connection with Jupiter. Now there is this technique, write it down in the notebook. This is a very important technique I always use and it always works. If the 5th house and 9th house are making any connection with Jupiter, then definitely there are good chances for childbirth. Second, 7th house and 5th house, now how they are working, see, according to sage Parashara, Kendra houses 1, 4, 7, 10, they are Vishnu Sthan, the places of Vishnu, the blessings of Vishnu. They show the work, how you work, Okay, how much efforts you do. So in the 7th house, a husband and wife coming together and doing some effort. Where will be the fruit? Fruit giver is Lakshmi. So 159, the Trikona, Dharma Trikona, that shows the fruits. That is Lakshmi Sthana. So Vishnu helps you to do work, Kendra houses, and 159 Trikona, Lakshmi Sthan gives you the fruits of it. So in 7th house you do efforts, union, and in the 5th house you get result of it. For that, 9th house is your destiny, 5th from 5th. 5th house is of past life punya. And 9th house is destiny, your bhagya, your luck. Is your luck supporting you for that? So for that, the Trikona is very important. But most of all of that, Lagna is very important. You will see, if the Lagna, there is Saturn placement, there is Rahu Ketu placement, okay, or there is Taurus Lagna and Sun is placed there, you will see solitary attitude in the person, separative quality. The person would like to be alone more of the time. There will be challenges, the female will feel challenges in union with the spouse. She won't connect completely with the spouse. Now, if she is not connecting completely, how the results will be there? And you will see, first house, Lagna is Kendra house. Also, it is Trikona Bhava. It is the first house of Dharma Trikona. So, it is Vishnu's blessing as well as Lakshmi's blessing. Lagna, you are capable to do work as well as you are capable to produce results of it. Both blessings are there in the first house. So, first house becomes very, very dominant. Okay. Now, these all are the factors. Now, how actually you make the prediction? These all are the important tools you will use to make the prediction and to know if there is infertility situation. But how exactly you make the prediction? First of all, you see Jupiter's condition in the chart. If Jupiter is getting affliction in the Lagna, in the Navamsha, now in the Lagna if it is getting affliction, you have to check in the Navamsha also. If in the Navamsha also it is getting affliction, then there is affliction. Okay. Now in the Navamsha shows your marriage and your soul connection with this physical world. So you will see that in Navamsha, if it is getting affliction, you will not have that soul bonding with your spouse. Now you see Jupiter's condition in the D7. If Jupiter is getting afflicted, if 5th or 9th house are getting afflicted in the D7, then definitely you will have blockage in progeny, in childbirth. Okay. Now, what it actually means? What is the meaning of Jupiter or 5th or 9th house affliction? Jupiter affliction, Jupiter is Jiva and Jupiter is Guru. Jupiter is the representator or the Guru who bless you with the punya, with the good deeds, with good karma, good blessings. Okay, Jupiter's blessing is like a nectar, divine nectar. Amrit tulya hai Guru ki drishti. Now we say always that. 5th house is your past life good karma and 9th is bhagya, your luck, your destiny. Now you see, if there is anywhere blockage, if there is any affliction in the Jupiter, 5th or 9th house, it means your past life good karmas are blocked by the bad karma. In this life, what people mostly do, we always have that no one is so pure, otherwise we wouldn't take birth again in this materialistic world. We have some bad karmas from past life. Now what we do? We start supporting the wrong theories, we start supporting mythology, we commenting on Veda, we stop respecting Veda, we stop respecting the divine, we start destroying nature. Okay. Now by that what we do, that we start earning more bad karma in the account. So it is like in the 5th or 9th house where you should have strength. Instead of that, you start getting strength to 6th, 8th and 12th house, to the bad karmic house, to the account of bad karma. Okay. So you were supposed to support Rajnikant. Instead of that, you start supporting the villain in the movie. What will happen ultimately? Definitely hero will lose. The same situation is happening. So now how you see the event, you have to see the transit of Mahadasha Lord Antardasha Lord, the transit of Jupiter Saturn, and the transit of Jupiter's sublord and nakshatra lord. Okay, when all of they make a good possibility, now obviously there are so many channels you have to check. There are these 4 or 5 channels you have to test all together, and it sounds complicated at first, but when you will practice, now we will take some case studies and you will see it becomes easy after 2-3 charts practice. Okay, now you have to see when they all are supporting 5th and 9th house, childbirth will be there. But will that be easy or will that be complicated? That is a different situation. I am not going on that right now, but first understand when that event will happen. Will you be capable to get a child or not at that age? If someone having, a female is having that conjunction of that support of dashas and transits at the age of 50, it is useless. What's the benefit of that? If she is having at the age of 10, that is useless. We have to see the age when she is actually trying or she is capable to have the child. That is also important. Now that's why in the chart, if you see that between 25 to 40 or 25 to 35, if there is no such event is triggering, it means you have to do the remedial measures. Now remedial measures are on different levels. We will learn all of them in the last segment of your course. The first is, what I prefer is color therapy, because every day how the transits are affecting your energy, you have to see which color will increase that energy more. You wear a small stone in your finger. That stone is receiving the energy from sun and reflecting it to your body. But you are wearing such so many clothes on all over around your body. What those clothes will do? Have you thought about it? So color therapy is very important there. For psychological issues, I see and prefer the Kapi meditation. That is quite influential, and I have seen result with many people with that approach. Putreshti Yajna, again, that is corrupted nowadays. We have to have the knowledge of Ayurveda and make the right mixture for Yajna first. And Putreshti Yajna doesn't work if a Brahmin come and do it in your house for one day. That won't work that way. You have to do yourself with full dedication for months. No, we again see in the 5th and 9th house, are there fixed sign or dual sign, movable or fixed, or dual, how it is working. With a fixed sign, it will be more complicated to cure those karma. It is a fixed karma. If there is dual or movable sign, it is easy. In some months you can cure it. With fixed sign, it can take years also. Okay. So to cure karma, how much time it will take, that is also important factor. Now let's take some example. Example will help you understand better.